If life was a book, what chapter of your life do you think shaped you as a person, as a doctor the most?
When I joined MBBS, I wanted to become a cardiologist.
What cardiac tests are and why they are important?
Heart is the most vital organ in the body. If you consider a farm, there is a motor. The motor takes the water from the well and pumps it across the farm, and each part of the farm gets water. The same job is done by the heart. Heart provides blood to each and every cell in the body. So if there is a problem in the heart, it affects each and every cell in the body from head to toe. So any disease with the heart is going to create an issue with everything in the body. So the tests to detect heart problem are most important. There are two diseases which are the most common chronic diseases which we see in India now. One is diabetes, another is hypertension, and both are called as silent killer. Means unless and until you check your blood pressure, so many individuals will never know that their blood pressure is high.
It is underlying. But
Yes, so many individuals who have high sugar, unless and until they check it, they will never realize this. So we see so many patients who that we tell a patient that चलो आपका stress करते हैं. So he is very scared. क्या निकलेगा अभी इसमें? ये होएगा वो होएगा. I always tell them a story. There is a room. You want to enter the room at 11 o'clock at night. There is a furniture in the room. How would you like to enter the room? Putting the light on or keeping the lights off? Then the patient himself tells me, I would like to put the lights on and then enter the room because that will help me avoid the furniture and a fall. So putting lights on is what you do by doing a test.
hello everyone and welcome to another insightful episode of Azkka Virtue podcast, where we bring science, clinical wisdom and the real world healthcare conversations together for doctors, patients and caregivers alike. Today's episode is extremely important because let's be honest, most of us only think about heart test after a problem happens. But what if understanding these tests early could actually save lives? Today, we are talking about cardiac test where every patient should know. And to help to decode this topic, we have with us Dr. Abhijit Pathak. With over 25 years of experience as a consultant interventional cardiologist, he is a director and interventional cardiologist at Swasthya Hospital Medical Research Center, Ahilyanagar, Maharashtra. Sir, it is such a pleasure to have you for this topic particularly, which is very less talked about. And I feel really honored to have you, that you have spared time for us and joined us for this conversation.
Thank you. Thank you so much for giving me an opportunity to talk to you in person and to a public at large, because it's a very important topic from understanding point of view, because there is so much array of tests, cardiac tests that are available in the market. So which one to choose when, that is I think the most important issue as far as the patients are concerned.
So sir, I'm personally very excited because I think not only for viewers but even for me personally, I feel a lot needs to be understood regarding this topic. So sir,
Right.
I'll move right into the first question. Sir, every life has certain defining phases, moments that quietly shape of who we become, both professionally and personally. I would. If life was a book, what chapter of your life do you think shaped you as a person, as a doctor the most?
In my opinion, my childhood, my father was a doctor, and I have seen medical practice from close quarters right in the early age of my life. It had a positive and a negative impact as well.
Right.
But the positive impact was so much more than the negative impact that that shaped my career. And to be true, whenever I joined medical school, on day one, when I joined MBBS, I wanted to become a cardiologist only.
Wow.
That was kind of an infatuation, because at that time I hardly knew what cardiology is all about. But that liking for a particular branch was the most biggest driving force for me, so as to pursue all the hardships, exams, hardships of training in my MD medicine days and DM cardiology days. To survive all that, the passion was the most important factor. And I always, so many young graduates, MBBS graduates, they come to me to ask advice as which branch they should take. I always tell them the last line, that follow your passion.
So true. So true.
Because medical practice is not something which you can do mechanically, because somebody's life is at stake, and whenever somebody's life is at stake, you have to consider that person as your relative. One of a very senior cardiologist, Dr. Fayal Shaw, used to say in his teaching programs that there is a very simple test to decide whether this procedure should be done in a given patient or not. So people used to listen to him very eagerly that what test he is going to tell. So he used to say that it's a very simple test. This is called as Mamma Papa test. Consider the patient as your father or mother. If you're going to perform this procedure on your father or mother, then it's okay that you perform it on the patient.
Wow.
Otherwise, you don't do it.
Such a simple thing, but so powerful.
Yes, very true.
So, sir, I think listening to you, it is indeed very inspiring and powerful. But it also, reminds us that some things are just destined to happen.
Yes.
I mean, you being born in a family where you're seen throughout your life, where they are practicing parents you have. And first of all, you have that instinct that yes, when you want to become or take up a branch, then cardiology was that one of the branch.
Yes.
And having said that, that being destined, after now more than 25 years, I'm sure thousands of patients in the city of Ahilyanagar and across have got your services.
Yes.
And it is indeed something very, very inspiring. Now let me move to the topic, the core topic for which I am personally very excited. To begin with, sir, could you help our viewers to understand that what cardiac tests are and why they are important?
First of all, heart is the most vital organ in the body.
Absolutely.
If you consider a farm, there is a motor, and the motor takes the water from the well and pumps it across the farm, and each part of the farm gets water.
Right.
The same job is done by the heart. Heart provides blood to each and every cell in the body. So if there is a problem in the heart, it affects each and every cell in the body from head to toe. So any disease with the heart is going to create an issue with everything in the body. So the tests to detect heart problem are most important. In my view, the tests are done in two ways. One, now people are aware after 40 years of age, so many patients or so many individuals who are not patients, they themselves they want to do tests to find out if they are having any cardiac problem.
Right.
These are called as preventive tests or so called as screening tests.
Right.
And some are symptom directed tests.
Right.
What are symptom directed tests is somebody has symptoms, like somebody who is getting chest pain on walking or climbing stairs,
Right.
chest pain on climbing on a steep ground. If they are getting these symptoms, they are getting breathlessness on walking a steep ground, then they would like to know what has gone wrong. So this is the way these tests are done. But mind you, there are two diseases which are the most common chronic diseases which we see in India now. One is diabetes, another is hypertension.
Absolutely.
And both are called as silent killers. Means unless and until you check your blood pressure, so many individuals will never know that their blood pressure is high.
It is underlying. But
Yes. So many individuals who have high sugar, unless and until they check it, they will never realize this. So we see so many patients whose blood pressure is say 180 by 110, and they are just comfortable, they are doing nothing. We see so many patients whose blood sugar is 350, but they are walking around, they do not have any
they are not
symptoms.
even aware of it.
Exactly. So in fact, the Time magazine had run a cover story on this topic at one point of time. The diabetes and hypertension, the silent killers. So these two diseases can be detected only by doing screening tests. There is no other way of detecting diabetes and hypertension. The yield of screening test for these two diseases is very good. The yield of screening test to detect the decreased blood supply to the heart is limited. But the yield of the symptom directed tests is very good. So if somebody is getting chest pain on exertion, if somebody is getting breathlessness on climbing stairs, especially someone who is used to do that kind of an effort earlier.
Right.
So if they were used to this and now they are unable to do it, so that itself means that there is some issue. So such patients generally baseline blood investigations are done. Simple tests like hemoglobin, blood sugar, blood urea nitrogen, creatinine to check the kidney function are basic tests which are done. In addition to that, one electrocardiogram is done. So many people have that misconcept that my ECG is normal means everything is fine. But mind you, ECG is taken when you are sleeping on a flat bed. So the changes in the ECG may not be there when you are climbing stairs.
Right. So there is no movement that time.
Exactly. I always tell patients that suppose I have 10 rupees in my pocket and you ask me to give 8 rupees, I'll immediately give you 8 rupees. You will never realize that how much money is there in my pocket.
Right.
But if you ask me 11 rupees, then I won't be able to give you. At that time you will realize that this person has only 10 rupees in his pocket. So unless and until somebody exerts, then only you will come to know that there is some decrease in the blood supply to the heart. And that's the importance of doing a stress test. Stress tests are done in multiple ways. Common is a treadmill test. People are made to walk on a treadmill and their ECG is taken, and depending on the ECG we try to diagnose whether the blood supply to the heart is decreased or not. There is a test called, slightly advanced test called stress thallium also, where you do a treadmill test, and at the peak of the treadmill test they inject a injection in your body and the images are taken through a gamma camera. So that is also a very sensitive test to detect the decreased blood supply to the heart. And a very basic test like 2D echocardiogram also is very important to detect how much is the pumping function of the heart. Because as I told previously, heart is a motor in the body. Whether the motor, normal motor suppose is 8 horsepower. If you have only 2 horsepower motor left, then obviously you will have a lot of symptoms. And how do you detect it? By a simple test called as echocardiogram. Echocardiogram can be done in 15 minutes. Its availability in the city of Ahilyanagar also, I think there are more than 25 centers who do 2D echocardiogram. So availability is very good. So simple tests like 2D echo and stress tests will be able to guide you whether you need to investigate your symptoms at a higher level or not. If the echo and stress tests are normal, generally these people will not have significant ischemic heart disease. Though these tests have limitations, they are not 100% accurate. But the accuracy of both tests put together is almost to the tune of 85 to 90%. Generally these tests will be sufficient. If you are in doubt, if the tests are positive, then people are subjected to tests like coronary angiography. Coronary angiography is done in 2 ways. One is a non-invasive coronary angiography, which is done by a CT scan. The advantage is it's non-invasive. They inject a contrast in your vein and image on a CT scan. The limitation is the accuracy is not 100%, it is around 95% accurate. The Catheter angiography is an invasive test.
That's a conventional.
It's a conventional angiography,
Right.
which is done through catheters. Catheters are inserted either from the hand or from the leg, and they are hooked in the coronary arteries of the heart, and contrast is injected and imaging is done through the image intensifier in a cath lab.
Right.
The catheter angiography is a gold standard.
Right.
It is almost 100% accurate. It will detect all kinds of blockages. We will be able to show what is the percentage of blockages. So generally, after doing a catheter angiography, you come to complete conclusion whether the blood flow to the heart is normal or abnormal.
Right.
And depending on your conclusion, then you plan your subsequent treatment.
Okay.
Certain tests which are done in patients who have acute symptoms, that also I would like to highlight.
Right.
If somebody has an severe chest pain, then some cardiac enzymes are done. They are called as troponins,
Right.
troponin I or troponin T. So these tests, they are cardiac biomarkers. They are used to detect whether the patient is having decreased blood supply to the heart in last few hours.
Okay.
So these tests, they come positive within first few hours of decreased blood supply to the heart.
Okay.
Sometimes in some rare patients, the ECG may not show the complete picture. Or it unfortunately it happens so that some patients right from their childhood have some abnormality in the ECG.
Right.
They are very few, but they are there.
Right.
So in these patients, if they have acute symptoms, such cardiac enzymes also help in detecting decreased blood supply to the heart.
Got it.
And couple of another tests which I would like to highlight, which have come in a very big way in last say 5 to 6 years. For patients who are coming to hospital casualties with breathlessness, so many times it happens so that their ECG is abnormal and the treating physician is suspecting heart failure.
Okay.
What happens is, though I already told you that 2D echocardiography facilities are widely available, but it requires a expertise.
Right.
So that expert person may not be available in the casualty at 2 o'clock in the morning.
Right.
So at 2 a.m. what does the physician in the casualty do? So he does a test called as NT-proBNP.
Okay.
N-terminal proBNP. B-type natriuretic peptide. This is a test. If it is high, that means that the patient has heart failure.
So that is a blood test.
That's a blood test.
Okay.
It is available as a point of care test. In even in our hospital, we do it so often as a point of care test. Means patient comes, we just draw his blood. The test is available in next 20 minutes.
Right.
So that helps to a very great extent because if the NT-proBNP say is in thousands, 5,000, 6,000, then we are very sure that the patient has heart failure.
Otherwise, sir, what is the normal range?
Normal range is less than 125.
Oh.
So if somebody has
Highly
6,000 NT-proBNP, then we are reasonably sure that he is having a left ventricular failure, and the management is started on that ground. And the echo is done maybe in the morning.
Right.
So those 4 hours from 2 o'clock to say 8, 9 o'clock in the morning. So those 5, 6 hours, a patient gets a very good treatment because his diagnosis is done.
Right.
So these tests have changed the way we practice because they are point of care. The machines are they don't require any expertise, and that has played a vital role in managing sick patients, especially in casualty. So I feel this is the gamut of the cardiac tests, and they have changed the way we practice. Means as a cardiologist, I have seen troponin coming in the market It was not there when I became MD medicine, and it came in the market when I was doing DM cardiology. We have been doing this test so often in our patients. So now we know the small nitty-gritties of this test, that suppose somebody's NT-proBNP comes, say, 700. On paper it looks grossly abnormal.
Right.
But if the patient has severe breathlessness, then we realize that 700 is not correlating with his breathlessness. So his breathlessness is because of something else also.
Right. So your clinical experience over the years and this advancement of test helps to diagnose and manage the patient much.
Because it is always like that medical practice is lot of science and little bit of art. So it is always like that. So the science part of it is very frank. It has hard endpoints, and the art part of it has lot of things which you try to correlate. And in fact, now so many AI models are coming, which will, if you feed the entire information of the patient, the AI will tell you that a given patient of left ventricular failure may be responding to this kind of management. But these models are all at present in pipeline. They are not finished product as of today.
Really, thank you so much for breaking this down for us, and this gives a lot more clarity to each one of us. That right from the stage where there are no symptoms, what is to be done, from the stage where you start getting symptoms, and how it is further managed at clinical level. So I think this is indeed very, very important and useful information for all of us, I would. So sir, I'll start very simple. When someone visits a doctor for a heart checkup, what are the most basic cardiac tests usually advised?
Generally, a baseline ECG, 2D echo and stress test are the three tests which are advised to majority of patients, because if they are normal, then it rules out so many factors. If they are abnormal, it rules out so many factors.
Also reading that if somebody comes with some symptoms, is TMT avoided in those cases, or TMT is still advised?
If somebody has acute symptoms, then TMT is definitely not advised. In that case, we do an ECG. So many times, if the first ECG is obviously abnormal, then acutely treatment is started based on that ECG. If suppose that ECG is normal, and the doctor's judgment is that yes, this patient is having some kind of problem, then we ask the patient to wait in the casualty, maybe give him some medication, and repeat a ECG maybe after half an hour or 45 minutes. If both these ECGs are normal, then the chances of patient having any great abnormality reduce to a great extent. Because what happens, first ECG is normal, you send the patient home and patient crashes at home. So we always insist that if the patient's symptoms are typical, patient's symptoms are acute, then we ask the patient, and the ECG is normal, then we ask the patient to wait in the casualty for 30 to 45 minutes, repeat a ECG. So many times we have picked up that first ECG was normal, second ECG was abnormal, and there we picked up a patient who had a ghastly disease in his heart. So
sir, as you mentioned earlier, that ECG is taken when the person is at rest, they are lying down position. TMT is done with movement it's a treadmill test, so while moving it is done. So that is pretty clear. What exactly 2D echo identifies?
2D echo identifies the structure of heart. Heart has 4 valves and 4 chambers. See, you can see all these chambers and all these valves very effectively on 2D echocardiogram. Whether the chambers are contracting or not. What is the pumping function of the heart? Heart valves, they are responsible for maintaining unidirectional flow. They should allow the blood flow only in one direction. If the valves are damaged, then there is a leakage, and then the blood comes back, and that is called as regurgitation of that valve. If the valve is narrow, then it hinders the forward flow of blood through that valve, and that is called as stenosis. So all these things can be picked up so well on a 2D echocardiogram that for especially valve problems, so many times 2D echocardiogram is a final test.
Right.
It is 2D echocardiogram and color Doppler. It's a final test, and depending on that, we decide whether this patient needs nothing, whether the patient needs medical management, or whether this patient needs a surgical management. All these things can be decided with a lot of confidence by doing a 2D echocardiogram.
So sir, this also makes me curious for my next question, that many people think heart tests are only needed when someone has chest pain or heart attack or any symptoms, I would say. But is that really true? Why should a normal person even know about cardiac?
It's very important because cardiac disease, unfortunately, is having a very increasing trend in India. Secondly, it is affecting younger individuals.
Right.
Those are, majority of them are breadwinners for the family. The Asian population per se is very prone for developing what is called as premature coronary heart disease. Like heart disease in patients who are less than 50 years of age, whether it's a male, whether it's a female. Secondly, we already discussed that diabetes and hypertension, unless and until you check it, you won't be able to detect diabetes or hypertension. So these tests definitely need screening. Anybody who has a risk factor, what are the risk factors? Being male is a risk factor. Then smoking is a risk factor. Diabetes is a risk factor. Hypertension is a risk factor. Family history of heart attack in a first degree relative, a blood relative, is a risk factor. So if anybody has these risk factors, then it makes more sense to do all screening tests periodically, maybe once in a year or once in 2 years, so as to be sure that you are not harboring any disease because of your risk factors. Controlling risk factors is definitely important, no doubt about it. But some risk factors like family history you can't change.
Right.
So those people have to do screening tests. What we have seen so many times, that if the father has suffered a heart attack at the age of 50, the son suffers another heart attack at the age of 40. So so many times it happens so that the problem comes 10 years earlier in the next generation.
Okay.
So if there are risk factors, then definitely that population needs a very aggressive screening.
Right.
Yeah.
So sir, usually what age you recommend? If a person has risk factors, then from what age should they start screening? And if they don't have risk factors, then from what age?
Generally in males above 40, everybody should start screening. In males who have risk factors after 30, they should start screening. This was definitely, if you would have asked this question to me 10 years ago, the figures would have been much bigger, like say 40 or 50. But today we see so many younger populations suffering from heart disease, so the age definitely should be lowered. In females, they have a protection because of their menstrual cycle. So in females, those who are above 50, maybe they should undergo a screening test. If the family history is there, if there is some risk factor, then maybe at 40 in females.
So that's such an important point, that heart disease, doesn't always come with loud warning bells. So it is very important that we screen and start screening at the right age.
Right.
So when do doctors move from basic tests to advanced tests, like you mentioned, a CT angiography or a conventional angiography? Yeah,
if we do a stress test, the stress test is strongly positive, patient has symptoms, then obviously patient needs a angiogram. Catheter angiography is preferred in such scenario because it is 100% accurate. We can plan the treatment for the coronary artery disease depending on that. So if the symptoms and tests, when both are abnormal, then definitely all further investigation should be carried out.
So just out of my curiosity, I'm asking. So we usually meet people, and in general, when we talk, do get screening done. So they always come with some excuses. No, I run a marathon. No, I climb 5, floors a day. So I think my heart is healthy. Is it really true? Is there any parameter where you can feel that okay, so if this is the level of exertion you can take, maybe you can avoid screening?
Screening and day-to-day exercise should not be intermingled together. That's why we see so many news features where news is reported that there were deaths during marathon or sudden deaths in people gym. Yeah. So few days ago we got a patient who had heart attack 6 o'clock in the morning. So young chap, say 32-year-old. So I on my rounds at 10 o'clock, I just asked him that how did it all started? Did you get up from your sleep because of chest pain? So he said, no, I was doing gym at 6 o'clock in the morning. So he was doing gym at 6 o'clock in the morning when he got a heart attack. So exercise is a very great thing, but if you are not getting symptoms, it does not guarantee that you are not harboring a disease. Everyone needs a screening, especially people who have risk factors.
True.
People who have risk factors should be definitely alert, and they should be doing screening every once in a year or once in 2 years.
This, I think, for all our viewers is a very important takeaway that we should not self-diagnose.
Right. Very true.
It is very important that we get things screened, and where the facilities are available across very easily. So I think that is something which absolutely should not be ignored. So if someone is 30 plus, working a stressful job, maybe not exercising regularly, should they do preventive cardiac testing?
Stressful job is a very funny term because I have a patient who has hypertension. We can measure the hypertension, so it is a measurable risk factor.
Right.
If somebody is diabetic, we can check his sugar, so it can be measured very well. Somebody has a stress, it cannot be quantified. How much stress that you have, suppose that cannot be quantified. So stress is something which is perceived, it is never measured.
Right.
So somebody who is feeling stress definitely should undergo screening, and at the same time stress management, which is done by either counseling or so many simple things like meditation, breathing exercises are also important
Right.
for that particular person who is feeling too much of stress. And one should always realize that stress is a very funny thing, because how it will affect a given individual no one can predict, and suddenly some ghastly disease may prop up out of it. So if somebody is stressful, definitely he needs screening, and at the same time measures to manage stress.
So as you said, so managing stress is definitely in our hands. What was considered as a older age problem, I would say maybe say 15-20 years back, heart disease, now it is, you are seeing maybe a decade earlier now.
Right.
And I think all the controllables like lifestyle or managing stress or eating the right food, exercising is something which is controllable. And I think for all our viewers, that is a very important message, that you work on your controllables at least, and then obviously you cannot change your genes, but something which can crop up, or harbor maybe say 10 years earlier, maybe you can postpone it to say 15-20 years, is something very, very important. Sir, I also know of people who delay test because of fear because of reports, because of the hospital setup. Imagining a hospital
Very
setup itself can cause fear, even cost for that matter, in a country like us. What would you say to them?
Uh, Cost is one factor that is not in the control of doctors or the community per se. Let's keep it aside. But fear is something we encounter so often that we tell a patient that चलो आपका stress test करते हैं. So he is very scared. क्या निकलेगा अभी इसमें? ये होएगा, वो होएगा. I always tell them a story that if there is a room, you want to enter the room at 11 o'clock at night. There is a furniture in the room, and how would you like to enter the room? Putting the light on or keeping the lights off? Then the patient himself tells me, I would like to put the lights on and then enter the room because that will help me avoid the furniture and a fall.
So true.
So, putting lights on is what you do by doing a test. Test is not going to change the disease in you. If there is there, you will come to know it. If there is not there, you will be assured that there is nothing. So doing test is just putting on a light in a room which is dark. So I always give this example, and I feel it works in so many people. People realize that by doing test, we are going to detect what it is there, not going to detect something which is not there.
Right. So I totally understand. I mean, when you see patients day in and day out, it is not just treatment. I mean, I think this part is also so much important of your practice and day-to-day life, that counseling patients, making them comfortable
Very true.
to, initiate a test or maybe prepare them for a procedure or an intervention.
Simple. If I tell patients that you do such and such test, he tells me, I am very afraid. I tell him, get lost. You are unnecessarily getting afraid. Don't do test if you don't want to do it. If I give him this example, then obviously he is an intelligent man. He will also think for himself for a minute and will get ready to do the test.
Right. No, that's very important. So, moving to the next question, which is really, a talk, which is artificial intelligence. Technologies, taking leaps and bounds across the industries, across the, branches. Medical science is one of them.
Very true.
We are hearing a lot about AI reading ECGs and predicting heart risk. Can AI really detect heart problems earlier than the traditional human interpretation?
Such AI models are already in place in places like Cleveland Clinic. If you give me a ECG and tell me, see this ECG, if it's a normal ECG, if you feed to AI will tell this is a normal ECG. This is ECG is of a male patient. The sex is detected by AI, which normal human eye of a cardiologist who is well trained cannot detect. The AI can detect the possibility of that person to develop left ventricular failure in next 5 years. AI can detect if the patient had any heart rhythm problem. I'll tell you one story. One nephrologist from Cleveland Clinic was following up with their own with the medical department over there. So he himself was a doctor. So he said, I'm okay. I'm coming for a routine follow-up. So his ECG was taken and ECG was normal. So as a routine protocol, the ECG was fed to AI. So AI report came that this ECG, given ECG is normal. But this person is developing abnormal heart rhythm in past and is likely to develop in future also. So they did 7 days halter, that is 7 days ECG on a machine of that particular nephrologist, and they detected 4 episodes of abnormal cardiac rhythm in him in next 7 days.
Okay.
I'll tell you one story that they were collecting data. AI is all about collecting data, as you know. So there was a ECG, sequential ECG of a person, and they were detecting the age. The age was increasing, and suddenly on one ECG, the AI said that the age has decreased.
Okay.
So the analysis was done as how come this is a mistake. So they pulled up the history sheet of the case, and when they saw all the record of that particular ECG, what they must have realized that on that particular instance, patient had undergone a heart transplant.
Oh, wow.
So he had got a younger man's heart, and that also AI had detected that his age, the heart age has decreased. So such things are possible. Incidentally, as of today, for diagnosis and treatment of all medical conditions, AI is of great help to doctors.
Right.
But on its own, AI is unable to help directly to patients as of today.
Right.
So patients should not be using it for treatment 100%. That these are my symptoms. I put it on Chat GPT. Chat GPT tells me something. I start taking treatment by you. My pharmacist is my friend, so he will give me drugs. So I start treatment. That should not happen. It should be always in consultation with doctors. Chat GPT like models are very useful for doctors to correlate things.
Right.
But for patients per se, it should not be used for treatment.
So, sir, I also try to relate. I mean, your 25 plus years of experience, as you said, when you just entered the field of cardiology, test of troponin just entered.
Yes.
So that further strengthened your way of looking at things. Then the newer test came in, that further strengthens. I think AI as a technology is only helping to further strengthen the medical fraternity's hand to ensure better care
Exactly.
and be more precise
Yes.
in their approach to
Very true.
the patients. Wow. So I think this entire conversation personally has been very meaningful for me. I understood a lot of things. So I'm sure all our viewers at large will be benefiting so much out of it. So as we close today's episode, one thing is very clear: cardiac tests are not just hospital procedures; they are powerful tools of prevention. The biggest shift modern healthcare is trying to create is simple. Don't wait for symptoms. Understand your heart before it asks for help. Heart diseases often develop silently, and timely testing can change outcomes, improve quality of life, and in many cases, save lives. Because when it comes to heart, early knowledge is not anxiety, it is protection, I would say. So, sir, thank you so much for sharing your experience, your clinical wisdom, and practical guidance with our viewers today. And for our valuable viewers, the best time to check your heart was yesterday. The second best time is today. So it is very important that we never ignore this and we get our hearts tested and screened as early as possible. Thank you, sir. Thank you so
One
much.
take-home message I would like to say.
Absolutely, sir.
There is a Kabir का दोहा, दुख में सुमिरन किए सब, सुख में किए न कोय. दुख में सुमिरन किए सब, सुख में किए न कोय. सुख में सुमिरन किए तो दुख काहे को होए. If you do tests when you are all right, you will not fall sick.
That's such a powerful message and very rightly and creatively put forward. Fantastic.
Thank you.
Thank you, sir. Thank you for joining us. It was indeed our pleasure to have you and sparing your valuable time early in the morning. I had a great time interacting with you. Thank you so much.
Thank you. Thank you for giving me an opportunity to talk to you in person and public at large. Thank you.
Thank you.